So looking at new diagnosis, this is, it's important to look at this because some people think that the aging of the HIV epidemic means that we have more people being diagnosed, more and more people being diagnosed at a later age. And here we have diagnosis of AIDS and HIV by year between 2002 and 2007. And I wanted to highlight that in the year that we had the largest reported cases among men, which was 2002, there were only 1,200. If you compare that to the 18,000 that were living with HIV/AIDS, you see that the most important factor is the group of people who are aging, the cohort that is aging, not the new cases that have been diagnosed. This is the same situation with women. And here, this is HIV diagnosis among 50 and older by gender. And obviously, you see the male to female difference. But strikingly, it's a ratio of 2 to 1, roughly, in this group, which may have many reasons to be to account for. These are new diagnoses by race and ethnicity, HIV diagnosis between 2002 and 2007. Roughly, just to highlight that despite slowing of the diagnosis among blacks, the rest of the group remained relatively stable. Okay, so there are no significant changes there. Now, unfortunately, in New York State, we don't have a good data set to look at chronic diseases, to look at morbidity and mortality for that matter on HIV/AIDS patients. So we look at the Medicaid data set and the SPARCS data set. You know, SPARCS is discharges from hospitals among persons diagnosed with HIV and other diagnoses. So we look at this three conditions: diabetes, metabolic diseases, and cardiovascular diseases. And this is what we have for combining SPARCS in red and Medicaid in red. I'm sorry, SPARCS in green, Medicaid in red, for diabetes among persons living with HIV/AIDS between 1996 and 2005. An upward trend in both data sets. Other metabolic diseases also show the same pattern in both data sets, other than diabetes, I mean. And on cardiovascular diseases, we only saw a trend upwards with hypertension, which is obviously related to age. We know, it is known, that the main three modifiable risk factors for chronic diseases are smoking, physical activity, and diet. And if you have a population in which we have some level of immunosuppression in the past, and we have the presence of this chronic risk factor for chronic diseases, you're going to have a significant incidence, a prevalence of chronic diseases down the road. So we assessed 4 years ago the prevalence of smoking in the HIV population in care in New York State, and we found that 59% of those were smokers, plus 24% were previous smokers. So if you compare that to the general population in New York State that had a rate of 16.8 in 2008, we are talking about more than 3 times the rate of smoking in the HIV population compared to the general public. This is a huge public health issue that has a need to be addressed. We have been working on this issue for the last 4 or 5 years, and I know that many of you have jumped on this issue and helped us with this, but we need to really work long-term to reduce the prevalence of smoking in the HIV population. We're also putting together a consortium on chronic diseases and HIV with clinicians and providers across the state to assess the baseline prevalence of both physical activity and diet, and also to reassess and to measure progress, if we have done any, between 2005 and now in terms of smoking. Finally, let me talk to you about cost. It is known in the general public that the increasing age means increasing healthcare expenses. And this data from Dr. Reinhardt, published in the New York Times, show that the rate of expenses of the 65 to 74 population is 3 times higher compared to the 34 to 44, and it goes up with age. In New York, we know that in the Medicaid program for the year 2007, that those 40 and older had Medicaid expenditures up to $40,000 compared to $23,000 on the 40. So I think this is another implication long term in terms of cost, healthcare expenses that need to be taken into account, particularly when we advocate and lobby for services. There's going to be a workshop on financing and payment for these expenses that I encourage you to participate. Thank you very much.
Thank you, Alvaro.